I'm supposed to introduce Dr. Lisa Van Susteren. She's one of the top psychiatrists and medical doctors in America, and she's been focused on climate change. She's brought together generals and physicians and a range of experts to develop a profile on the psychological impacts of climate change on American society. And her conclusion is, we're not ready. That the traumas that are on the horizon are bigger than we suspect, and public health has not yet prepared itself for those challenges. She's been so effective at times that she got a surprise phone call one time. It was from the CIA. And she was asked to do profiles on world leaders and how they would behave under pressure, under stress. And this simply characterizes the effectiveness of Lisa in her work. And now she's going to talk to us about the public health challenges associated with climate change. And I want to introduce Laura Wenzel. And I've never met her before.
I've spoken on the phone many times, but yeah.
Thank you
It's
very
great
much.
to see you.
Good morning. Thank you for coming to this, and I want to thank Karen and Fred for inviting me here. And Lisa and I are going to kind of do a tag team talking about the health impacts of climate change. Fred introduced Lisa a little bit. I'll tell you a little bit about myself. I work with Clean Air in Carolina. I run a program for Clean Air in Carolina called Medical Advocates for Healthy Air. And by the way, I want to give a shout out. We're having a conference called the North Carolina Breathe Conference on March 28th at the Museum of Natural Sciences down the road. It's a Tuesday. It's going to be all day long, and you can go to ncbreatheconference.org for more information, or check out the cleanaircarolina.org website. And I do have materials on the table over here by the window. But anyway, Lisa and I kind of organized a talk where she's going to be introducing some of the general impacts of climate change on mental and physical health, and I will follow up with impacts specific to North Carolina and solutions that we see. So, hi Lisa, how are you? I don't know, I guess I should look in the video camera to see her, Tom, or Joe. Can she see me?
Probably
Okay, it looks like they are having some technical difficulties for Donald and he's calling him now. So anyway, I'll tell you a little bit about Clean Air Carolina while we're waiting for this to start. So Clean Air Carolina is a nonprofit working on air policy in North Carolina, and it's headquartered in Charlotte. It actually started out as a group of people involved with the Sierra Club in the Charlotte-Mecklenburg area who were concerned about the very poor air quality that we were experiencing there about 10 years ago. And 2 years ago, the Charlotte-Mecklenburg area finally attained the EPA standard for ozone, which was a wonderful thing. But 2 days after that standard was achieved, the new ozone standard from the EPA was released, which was a few points lower than it had been, and so now Charlotte-Mecklenburg is still, they attained it this year, but just barely. So with our growing population, it's going to be a real challenge to not go above that ozone standard, and so we need to be working on solutions. And the thing is with working on air policy solutions and climate change is, climate change is caused by air pollution. So if we reduce our air pollution, then we are addressing climate change. And is Lisa on now?
Okay, well, first of all, thank you for your patience, and I'm thinking to myself, well, it's gonna be good, right? After all this, first you're not. Thank you for having me, first of all, and most of all, I thank was the hottest year ever recorded. In July, in Iran and Kuwait, temperatures reached 129 degrees. The West Antarctic ice sheet, a massive sheet the size of Mexico, that scientists have said is unstoppable now. According to Jim Hansen, sea levels have rise by roughly 3 meters or 9 feet as early as 2060, far higher and quicker than current projections. The question is, where will the displaced people go and who will take care of them? The ongoing drought of Syria was a factor spawning the geopolitical catastrophes in that region and created a refugee crisis, the likes of which we have not seen since World War II. It radiated fear and instability all over the world at the root of the sharp political turn to the right in Europe first and now here in the U.S. The extinction rate could be on track by 2050 to be as high as 50%. Through beautiful states, home of the Blue Ridge and Smoky Mountains, islands, forest, beaches, brimming with wildlife, a $2.4 billion tourist industry is also a place where good people from all movements to justice are working together in common purpose. You have a lot to protect and a lot to lose. I have had to talk about climate and health, and I will focus on North Carolina. Temperature. Hotter days and more often are ahead. Heat stroke, harsh earth, lower crop yield. Higher temperatures create ozone, the heating component of smog more quickly, and are a factor in keeping bad air close to the ground where we breathe it in. That's fire. Fires, last summer was tough. Fires cause asthma attacks that aggravate existing respiratory conditions. They can trigger heart attacks and, of course, so much more. How does it feel? What does it do to us emotionally? Seeing nature, life, a pile of ashes. Next slide. Drought. One of the toughest things farmers can face is standing on parched land, waiting and praying for rain that doesn't come. In India and Western Australia, suicide has spiked, depression for sure. Parched land for the fire. Western North Carolina has been hot hit. Flooding. 2016 saw terrible flooding in the eastern part of the state, and bacteria, viruses, parasites, chemicals, human and animal waste are washed into floodwater, and vectors swarming. Exposure to the water puts us into contact with these pathogens. We drink it, bathe in it, clean up in it, and after the water proceeds, live in it. Next slide. Dominion and Duke have about 14 coal ash sites full of heavy metals, cadmium, arsenic, nickel, and mercury, leaking into our water. Toxic to all of us, but especially the neurologic development of fetuses and young children. And they are also carcinogenic, harmful not only to humans, but to wildlife and all nations. Next slide. And then there are the pipelines making their way across our land, delivering what nobody needs and only the polluters want, fossil fuels. This is the Atlantic Coast Pipeline, and we will do everything we can to do what we have elsewhere, block it. Ask me about an update regarding the Atlantic Coast Pipeline later if you plan. Next slide. Infectious diseases, Zika. I don't like to say this, but there is every reason to believe that Zika, linked to climate change, will spread to the people of North Carolina. Moms and babies are, of course, most vulnerable. Next slide. period is happening entirely by accident. Many of us are already wondering, what will future generations see and feel looking back at? What will be their mental state? So you're ready for good news, right? Next slide. North Carolina, new block. The enlightened tax policy on solar, you are number 2 in the nation for solar. Our nation is solar. Next slide. Look at where Florida is, where I am right now. Despite all that's on here, number 18. So look at what being smart can do and being energizing and next slide. And look at what North Carolina's collective resolve has done up to offshore zone. Next up, for us, because of North Carolina's activism and wind, a very big installation and a very big force all around our country. Next slide. North Carolina may very well be the first state in the union to adopt the climate solutions policy. Mark Jacobson's roadmap for nationwide transition to renewable. We're all basically copycats, being the first of the heart, and North Carolina is setting the social norm for the rest of the country to follow, and we will. Next slide. So this is what collective, energizing action looks like. The people united. Thank you, North Carolina. 100% clean, 100% going to happen. Because we are going to stop our way. Thank you.
Thanks, Lisa, and if she could stay on the line, then we might be able to take a couple of questions in a couple of minutes, but if you want to, Joe, go ahead and pull up the PowerPoint from my presentation. So Lisa covered a lot of the points about health impacts. So it's that Acrobat file there, climate change. There you go, that one there. Perfect.
Laura, can you just pull the microphone just a hair away?
Oh, certainly. Sorry about that.
Is that a question to me? I didn't.
No, Lisa, you're fine. You're fine. I'm going to just go through my presentation real quick, and then you and I can have a little bit of a dialogue. So go ahead and advance the slideshow, please. Just there you go. Okay, so we just want to talk about. Lisa covered this pretty well. Last century.
I can't. If you're speaking to me, I can't understand.
Okay.
Tell her I'm not speaking to her.
Maybe speak into a phone.
Tell her on the phone that I'm not speaking to her.
But they interrupt you in a little bit.
Yeah, well, just me the phone. No, the phone. There you go. Hi, Lisa. Just hang on. I'm giving my presentation now, and you and I will talk. Okay, so last century we had about a month of days where our temperatures went over 90 degrees, and we are going to be seeing 6 months of days where our temperatures are going over 90 degrees. You can see the drought map, but that was last Thanksgiving, and remember what was going on in the mountains last Thanksgiving. We are going to be seeing a 400% increase in days with high risk of drought in some of our coastal counties. But we also are seeing a 27% increase in very heavy precipitation. And so there, and that's causing flooding. So sometimes there's some question about, well, why are we seeing heavier precipitation and drought? Well, what's happening is, we have months and months of drought where the land gets very hard, right? The earth gets very hard. And then you have these huge rainstorms, buckets just coming down all at once. The earth can't absorb it, and so you have runoff, and that's where our flooding is coming from. That's why you can have drought and flooding at the same time. Can you go ahead and advance the slide? I think you just hit the right arrow, and it'll advance it. There you go. Okay, so climate change has two modes. There's pernicious change, which is the kind of gradual temperature rise and increasing drought, and there's severe weather. And the impacts are a little bit different from each type of change. So, we have poor air quality. That's actually making our allergens in the pollen more potent. So for people with pollen allergies, they're going to be suffering more. We have already seen increases in heat-related illness, and you can see the darker color on that map on the top of the screen, where we have the higher temperatures every year. The shorter winters, they're not killing off our insects. You know, we pulled a tick off of our dog in December, and you don't normally find ticks in December. Well, we have a new normal now. And we are already a hot spot for Rocky Mountain spotted fever in North Carolina. And then we have sea level rise, which is so far gradual, but it is affecting our fishermen and people who are running tourist operations, bringing in people for recreational fishing. And of course, our farmers also are finding that they're having to change the crops that they're growing, change the time that they're seeding their crops. So these are issues that can cause economic distress, leading to psychological distress. Please advance the slide. Thank you. So the severe weather impacts, of course, we had Hurricane Matthew this year. We had the fires. This year, the fires, of course, they're a severe impact from a pernicious change of long-standing drought. We had kids out of school in some places for 8 weeks, and those were in some of the poorest counties in the whole country. I mean, the poorest counties in the state, but also the poorest counties in the country. And so that a lot of those kids, that's where they get their food, right, at the school. So being out of school, they're not only missing out on education, but they're missing out on the school nutritional services. And of course, we have Princeville. This photograph down here of the folks cleaning out the house in Princeville. I mean, that town is pretty much destroyed because it got hit by Hurricane Floyd about 15 years ago, and then Hurricane Matthew this year. And there are people who are saying, no more, I can't take it. Because, as Lisa said, you lose your sense of place when your home is destroyed like that. Please advance. So we also have to consider the impacts of climate change on our actual healthcare systems. So our healthcare systems are vulnerable for a number of reasons. First of all, there's access. The roads can be washed out. The communication systems can be destroyed. Then we have increasing likelihood of unfamiliar diseases that our healthcare professionals are not aware of how to diagnose and treat. And we have to also consider the traumatic stress on our first responders. So the ones who are in ambulances going and helping people who have been victims of floods and tornadoes and fires, that's very distressing. And their own homes can be at risk, and so their families can be at risk. And who are you going to take care of first, right? So healthcare systems need to be considering the families of the first responders. Please advance this slide. Let's look at some of the areas in North Carolina where we're particularly concerned. So asthma and cardiovascular disease are exacerbated by air pollution. There's direct cause and effect. And so you can see where some of the higher rates, the darker the color, the higher the rate of either the childhood hospitalization for asthma or the cardiovascular mortality. And you can see that a lot of the issues, the worst issues, are in our rural counties, which are also economically distressed. Please advance the slide. We have to consider our population differences in North Carolina. So we have an increasingly growing divide between our urban and rural areas. So Raleigh and Charlotte are projected to grow by 71% over a period of 15 years. Whereas in some of our rural counties, we're losing our population, a working age population. So we need to consider what sort of different solutions will work for these two very different areas. For example, in urban areas, obviously, smart growth and mass transit solutions make a lot of sense, whereas in rural areas, expanding our broadband so people can get access to information and expanding green jobs and developing solar farms and wind farms are good options. Please advance. So we need to also, as I was mentioning, get our healthcare systems to consider resilience planning and consider climate change in their sustainability plans. So actually the North Carolina Department of Health and Human Services is partnering with the CDC to do some education and preparation in various counties in North Carolina regarding heat-related illness and wildfire impacts to try to prevent those. And the U.S. Department of Health and Human Services has published a toolkit, which is very cool. It's on developing resilient healthcare facilities. And so one of the things the toolkit points out is that healthcare facilities are likely to become community centers in periods of severe weather. So they are going to be expected to provide more than just health services. So that's something that healthcare facilities need to become prepared to do, to provide those kinds of services. Of course, they need to provide for healthcare workers and their families. And this toolkit also recommends that they become more energy and water efficient and also become able to produce their own energy by, for example, developing solar panels, a solar system on their facilities so that if the grid goes down, they can continue to function. And there are private companies, one example is 427 Climate Solutions, but there are others, that are helping hospitals understand the impact of climate change on them and their surrounding communities and kind of develop a program for being able to handle these kinds of incidents. Please advance the slide. So Medical Advocates for Healthy Air is a program of Clean Air Carolina, and we recognize that medical professionals are on the front line of seeing the health impacts on their patients, so they have great stories to tell. They certainly have a vested interest in improving the health of their patients, and they also have a lot of respect and credibility when you're talking with a politician. As an environmentalist, they don't listen to you the same way as when you're talking to them as a nurse or a doctor. So Medical Advocates for Healthy Air is a program of Clean Air Carolina, and what we do is we train medical and health professionals about the health impacts of air pollution on health, because a lot of them, most of them, probably 95% of them, do not learn anything about air pollution and health in medical school or nursing school. And so we train them about that and the research. We also train them in how to become advocates and keep them abreast of policy issues so that they can become effective advocates for addressing climate change and air pollution in our air policies, making our air policies into health policies. So we encourage you to talk with your healthcare providers about MAHA. I have brochures on the table here. And as I mentioned, we are developing our North Carolina Breathe Conference, which is on March 28th. And I want to thank you very much and open the floor for questions for Lisa and me. Thank you. Okay.
Anyway, encouraging like the insurance companies that play such a role in our medical and healthcare to embrace some of this, like your programs, and make it a requisite for providers.
So the question was working with insurance companies and having known the impacts of climate change and air pollution on patients and working with providers. That's not something that's been on my radar screen, but it sounds like an interesting idea. Lisa, are you aware of anything about that?
Association of America is very involved in climate change advocacy, and they have been now for nearly a decade. They recognize the impacts on them. They're reinsurers, and they recognize that when they're the last resort, and they've been working very hard. In fact, we were very much a part of Al Gore's rollout of the climate project many years ago.
Joel. Good morning. Great presentation. I think there needs to be an examination and discussion about universal health care. For example, Medicare for all, expanded and improved. Because the way our healthcare system is designed is to exclude people from coverage, and when they go to the hospital, these gigantic copays, like mine, which are $50,000. And I worked in Congress, and my copays are $20,000. But I think there needs to be an intersection and a relationship with the movement, which is expand and improve Medicare for all, because as people get sicker, their medical bills will get greater and also be excluded from coverage often from insurance companies. That's what they're very good at doing.
Thank you. Lisa, just in case you didn't hear that, the comment was regarding the expansion of healthcare, of health insurance for all in
Medicare.
in Medicare for all.
I'm sorry, what was the question?
It was more a comment. I don't know that it was quite a question, but just that we need to be working on Medicare for all. Yeah.
Well, actually, the question really is, could there be an intersection? Could the green climate movement begin to intersect with the Medicare for all movement, which is really huge?
So the question is, can the green movement intersect with the medical access movement
Universal health.
for universal health care?
Okay, that for me, I work it's a wonderful question, and the whole issue of justice for all, that was the fundamental organizing principle of our country. And it isn't justice for all, if only a few people have access to health care, especially at a time when we know our health care is increasingly going to be compromised by the impact of climate change. It isn't justice for all, if only a few people can afford to get to high ground, safe ground, only a few people can get the scarce resources that enable us to live their lives free of fear. So this is a fundamentally a justice issue for all, and I think it's going to have to show that you can work together on that principle, and you are leading the way. I wasn't kidding, and it will establish a social norm that others follow suit.
There's some.
We have time for one more.
There's some very there.
Okay, one more, so point out one more question.
Okay, it's Fred.
This is meant to be a good question, but to our remote speaker. She's a professional psychiatrist. I am a lay person. Our current president appears to be mentally ill. And the question is there a clinical name for this, and how is it going to progress?
Well, I'm not sure it's ethically, you can't diagnose someone ethically as a psychiatrist who's, not your client. So the question was, is there a diagnosis that you would be willing to hear for President Trump and a prognostication?
Yes, there's a great question, and you can imagine, there are many of us pretty much foaming at the mouth, trying to figure out exactly what to do, and I am no exception. The Goldwater rule, which many of you know about, I won't go into it here, but it is our official ethical embargo against CDL. But I think there are cases where we have to understand that for reasons of humanitarian reasons, for concern about dangers that we need to focus on, that an intelligent discussion of what our vulnerabilities are. Everyone has vulnerabilities, but pretty much it's clear to all of us that people are seeking an answer for something that we have never seen before. And people deserve an answer, and they deserve an answer from people that have experienced talking about this and people who speak intelligently about it and judiciously. And I'm making a case with that we should do that. So I think we deserve that. I think people deserve to try to understand what's happening.
Thank